Okay, good evening, guys. I have your discussion tonight, and we are discussing diabetic DME. Okay, here we go with tonight's discussion. Short answer: DME isn't always preventable, but you can dramatically lower your risk by keeping blood sugar, blood pressure, and cholesterol in healthy ranges by setting your yearly dilated eye exams, because the earliest damage happens silently long before vision changes appear. What DME is and why early detection is everything. DME is a complication of diabetes in which damaged retinal blood vessels leak fluid into the macula, the part of the eye responsible for crisp detailed central vision. Over time, this swelling blurs vision, fades colors, and can permanently impair sight if untreated. The challenge is that DME often begins with zero symptoms. You may feel your vision is fine even while microscopic damage is progressing. That's why the article emphasizes annual dilated eye exams. They're the only way to catch DME early when treatment is most effective. What the article says about lowering your risk. The surrounding page content highlights three major modifiable factors: blood sugar control, high glucose levels damage retinal vessels over time, and HbA1c of 7% or higher is linked to increased DME risk. Keeping glucose stable reduces the biochemical stress that leads to vessel leakage. Blood pressure management. Hypertension accelerates retinal damage. A 2023 study cited the article found in a 24% higher DME risk in people with both diabetes and high blood pressure. Cholesterol and statins. Evidence suggests statins may help protect retinal vessels by reducing inflammation through The findings are mixed. The article frames statins as potentially protective, not not definitely preventative. Definitively preventative. Annual dilated eye exams. Because DME damage starts before symptoms, screening is non-negotiable. Detailed exam and OTC imaging can detect swelling early, long before vision changes. Here's what prevention really means here. The article is careful. You can't guarantee prevention, but you can meaningfully reduce risk by protecting the retinal blood vessels from the metabolic stress and diabetes. Think of it as lowering the pressure on the eyes, microcalculation, stable glucose, less vessel damage, controlled BP, less leakage, healthy lipids, less inflammation. Regular exams, early intervention before vision loss. The combination doesn't eliminate risk, but it shifts the odds strongly in your favor. If DME is detected, what treatment looks like. The page notes that early treatment improves outcomes. Standard options include anti-VEGF injections to reduce swelling. Laser therapy to seal leaking vessels. Combination therapy, depending on severity. The treatments are far more effective when started early. Other reason, screening matters. A practical checklist you can act on today. Schedule your annual dilated retinal exam. Ask if they use OCT. Bring your HbA1c, BP readings, and lipid panel to your eye appointment. Review whether your current medications support eye health risk reduction. Seek prompt care if you notice blurred vision, faded colors, or wavy lines. Review whether your Current medications support eye health risk reduction. Seek prompt care if you notice blurred vision, faded colors, or wavy lines. Questions to ask your eye doctor or PCP. For example, how often you should be screened based on your labs or whether your current medications align with the latest evidence on DME risk reduction. Core message: you can't fully prevent diabetic macular edema or DME, but you can meaningfully lower your chances of developing it and dramatically improve outcomes if it doesn't occur by managing blood sugar, blood pressure, and cholesterol, and getting yearly detailed eye exams. The article emphasizes that DME often begins silently long before your vision changes appear. Which makes early detection the real powerful tool for protecting sight. How DME develops and why early detection is so powerful. DME is essentially the eye's response to long-term metabolic stress from diabetes. High blood sugar gradually injures the delicate blood vessels in the retina. When those vessels weaken, they begin to leak fluid into the macula, the part of the eye responsible for crisp, detailed central vision. Over time, this swelling distorts vision, fades colors, and can lead to permanent loss. Untreated. What makes DME tricky is it that the earliest stages are completely symptom free. You can feel like yourself. Vision is perfect, while microscopic damage is already underway. This is why the article stresses annual detailed eye exams is non-negotiable. These exams allow eye specialists to look directly at the retina and catch subtle changes long before you notice anything. When something looks suspicious, doctors may use optical coherence tomography, okay, forcing angiography. Identify leaking vessels. These tools make early detection possible, and early detection is what preserves vision. The major risk factors the article highlights. The surrounding page content lays out 3 key health metrics that strongly influence DME risk: blood sugar, HbA1c, high glucose levels damage retinal vessels over time, and HbA1c of 7% higher is associated with increased DME. Keeping glucose stable reduces the biochemical stress that leads to vessel leakage. Blood pressure. Hypertension accelerates retinal damage. A 2023 study cited in the article found a 24% higher DME risk in people with both diabetes and high blood pressure. Cholesterol and statins. Some research suggests statins may reduce inflammation and help protect retinal vessels. Through findings are mixed. Those findings are mixed. The article frames statins as potentially protective, not a guaranteed preventative measure. What prevention really means here. The article is careful not to overpromise. There's no way to guarantee DME won't develop, but you can shift the odds dramatically in your favor by protecting the retinal blood vessel from the metabolic statin or diabetes. Think of it as reducing the pressure load on the eye. Okay, guys, that is it for tonight. I will see everybody tomorrow for shows or Monday for shows. For now, Gator Wellness. Take care, folks.